Top stories from around the island. To the point. Without the fluff. Puerto Rico headline news. Please subscribe and don't forget to hit the bell notification.
Hello and welcome to Puerto Rico Headline News for April 10th, 2020. This is your COVID-19 update for Puerto Rico, along with covering the latest information released by the Department of Health. I'm going to cover this Puerto Rico COVID-19 online information portal that was released yesterday. I'll show you what it looks like and how it works. If this is your first time here, please don't forget to subscribe, hit that notification bell so you'll be notified of whenever I do release new videos. Like this video, and please don't forget to share the content as well. I provide this service for those that live here in Puerto Rico and find it hard to find English-based news sources, and that's the reason I do this. So let's go ahead and get into this article. And here we see breaking news from El Nuevo Dia for today, April 10th. And the headline reads, Puerto Rico reports a total of 39 deaths so far from the coronavirus. And they had a slight error that took place in the information portal, and I'll go ahead and cover that as well. So let's go ahead and get into this article, and it reads, an update to the dashboard of the Department of Health this morning, Friday, reflected that the number of deaths from the coronavirus or COVID-19 on the island had increased to 39, while the confirmed cases increased to 725. However, when the Department of Health released the web portal yesterday, it showed 40 deaths, a figure that was later reduced to 33 yesterday. So it was a slight error. When these type of things get released, they're brand new. This is kind of to be expected, but they did correct the mistake. So continuing on with the article, it reads, in the health communication in the communication by the Department of Health, the agency admitted that last night there was an error in the numbers, which they corrected. But they went ahead and said, although yesterday's figures presented on the dashboard at the time of its launch reflected a total of fatalities different from those published today, they were corroborated to avoid duplication of data entered into the system. Once the correction was made, it was included in the final totals today, which was updated at 6 a.m. is what the statement read. Now, according to the Department of Health, of the 6 new deaths, 2 were people who had been tested already for the coronavirus and then later died, and 4 were added later after dying because their clinical symptoms at the time of dying were compatible or were in line with those symptoms from COVID-19. So they were classified in their death certificates by the doctors as dying from COVID-19. Now, the article continues to mention that since last Wednesday, the Department of Health has adopted new guidelines from the Centers for Disease Control and Prevention on how they monitor deaths during the pandemic. So that since then, the deaths of people suspected of having the coronavirus and whose clinical picture or assessment is compatible with that of a positive person for coronavirus, as certified by a doctor, they will be categorized as dying because of COVID-19. I put out a video yesterday that gives a little bit more detail on what the new CDC guidelines are. In a nutshell, if someone dies and they have not been tested, but their symptoms are COVID-19 like, the doctor can go ahead and categorize that particular death as one being caused by COVID-19 without actually doing a test. So it's really up to the doctor to make that determination. But these are the new guidelines from the CDC. So it appears that they might go back to previous deaths and analyze those symptoms and classify these deaths as being related to COVID-19. So we might see a spike in deaths that happened, days or even weeks before. So let's go ahead and continue with this article. And it mentions here the 2 people who died after being tested for COVID-19 were men from the Maya West region. One of them was 83 years old and the other was 84 years old. Now, of the 4 deaths, the 4 deaths that had symptoms that likely resulted in their death because of COVID-19, 3 are that of a 49-year-old man from the Bayamon region, one who was 84 years old from the Ponce region, and another man, 101 years old, from the Bayamon area. And then finally, under the same CDC guidelines, the death of a 73-year-old woman from Caguas was also reported. Now, of the 42 new confirmed cases today, 16 were obtained by the Department of Health Public Laboratory, 3 were provided by the Veterans Hospital, and 23 other confirmed cases were done reported by private laboratories here on the island. So as of today, the accumulated total of positive or confirmed cases, the breakdown is 349 are female, while 376 are male. And here we're going to see a couple graphs that you've grown accustomed to seeing. And this is the graph that shows us the amount of positive or confirmed cases that have been reported in Puerto Rico. So here we see the trend still heading up. And as testing does begin to increase the amount of people that are being tested, we can expect this trend to continue rising. Now, the following bar graph is pretty helpful, and it shows us that in Puerto Rico, 7,244 COVID-19 tests have been performed so far, of which 5,121 have come back as negative. The Department of Health agency did not offer the exact number of the tests that are away that are still pending, so that information was not released today. But here we see this graph, bar graph, gives us a breakdown by age group and by gender. Again, Puerto Rico, the 50 to 59 age group is the highest of those infected by the disease, followed by the age group of 0 to 29, very concerning, as opposed to information from other countries around the world that the concentration were in the higher age groups. Here in Puerto Rico, it's not quite the same. So here we see a large concentration in the younger age groups. So here's the next graph that this gives us the testing, the amounts of tests that have been conducted here on the island. The orange line are the pending tests, waiting on test results. You see the red line is the confirmed cases, and the black line is the reported deaths. Unfortunately, recoveries, or those that have recovered, has not been included. So this article came out yesterday by the Department of Health, and they actually launched this information portal yesterday. So I'm just going to cover a little bit of information. Here we see what it looks like. I'll open it up in a separate window, and we'll be able to take a closer look. But here it says the Secretary of the Department of Health, Lorenzo González, yesterday presented the new Internet Information Portal that records the official figures and the behavior of the coronavirus on the island. This will be updated once every 24 hours, a mechanism with which they hope to expand access to more detailed information to the public and to the press on the behavior of COVID-19 on the island. I'll provide the link as well to this portal in the description of this video. And finally, it says here, he explained, the Department of Health Secretary, that the new system will include variables ranging from the amount of tests with positive or confirmed cases or results to COVID-19 on the island, as well as the total number of beds available through all the hospitals in Puerto Rico, those that include intensive care, pediatric, isolation, among others, the total number of ventilators in use, patient conditions, and deaths due to the disease, among other variables, will also be reported. The information provided will also include details on where they're from and the municipalities to which each one of the cases reported with positive results for the coronavirus and where they are from. So let's go ahead and take a look. And if you see here, we have 2 links. I'm going to click on this link here. So here we're able to see the information portal that's being provided by the Department of Health. This information gets updated once a day, once every 24 hours at 6 a.m. And you'll see that down here. So here we see in this section here how many confirmed cases, 725. A little pie graph showing us the amount of the cases, those that have tested positive, come back negative, those that are pending, awaiting test results, and those that were inconclusive, along with the amount of total deaths. The accumulation of the amount of deaths is right here. Here we see the regions broken down by municipalities. So obviously we can see this high concentration here is the metropolitan area in San Juan, followed by Mayagüez over here, Ponce area down here to the south. We also see in this graph over here, or these numbers, the amount of beds that are available in the hospital and the breakdown of how many are being used, how many are occupied. 2,431 are being used right now. How many are still available? 972 out of the 3,403 beds. And we see the ventilator count that they have here. It says here 267 ventilators are being used right now. They have 800 that are still available. So it gives us a nice breakdown. Again, it's going to be updated once a day at 6 a.m. in the morning. And although it's only in Spanish, it's not too hard to kind of make out the information here as well. And then a lot of these are, you can hit these buttons and it'll give you additional information that you might find useful as well. And then you have the breakdown here by areas. You hit San Juan, it'll zoom you in, and then you can take a closer look as far as the amount of confirmed cases that are in these areas as well. So I will include the link in the description of this video. So please take a look, get familiar with it, and hopefully you'll find this information very useful. Thanks again for watching. This is Puerto Rico Headline News.